This is part 2, which discusses the problems associated with scarring related to the tube feeding of children with cerebral palsy. And we started with the general overview of the problem and the way how the scarring, tube feeding related, causes the fusion of the layers at the abdominal and thoracic levels respectively as a cascade, and that instead of the 4 distinct layers which are providing sufficient support rotations from above and rotation from below, everything is limited entirely just to the vertical surface action. So, and the other 3, they are very much missing, and that's what we want to recover. But in order to recover them, we have to reverse the scarring, and that in itself is already very much a miracle level task. So, and again, we're going to get some help from Google, and here we are. So, abdominal surgical incisions and abdominal scars, right? And here we are. Post-surgical abdominal scars are a normal part of healing that can initially appear red, raised, lumpy, and then eventually settles and so on. But the key question, which is not even kind of bring really intensely in this question, in this description, is that, okay, are they causing extra problems? And in fact, if they are causing extra problems, are they reversible? So, and here we are. So yes, scars are permanent. Why they're permanent? Because the scar is formed through a reparation process, not regeneration process. So the wound gets filled up with a simple, relatively simple collagen structures, and you can see here it lacks very much everything else that is found in a normal skin. And well, here is the conversation, just goes along the lines how to minimize the appearance of the scars. And then you can find lots of other things like why are scars permanent, and you get all sorts of the explanations there. Okay, so this one is some kind of, well, actually it's a life science, but it's really a site which is overfilled with all sort of ads. But these questions, you can see here, they're being asked all the time. 72 million search for the scars being permanent, and then you don't get much. So here we are, right? So you see that's the part which we are facing the situation. And again, the scar removal conversation is in fact only linked to the external appearance of the scars. So it's to make them cosmetically appealing. That's the only purpose, and obviously that's not the key thing for your child affected by cerebral palsy. What most important for you is to improve overall your child's development. So therefore, in this video we're going to study some aspects of this progress, and through progress, through the before and afters, we're also going to learn what are the essential aspects and what you should be looking for as the evolution of your child's tube feeding scar. So we already started with this part where we discuss the appearance of the respiratory system, and that's where we can see the wrong pattern versus much improved pattern of the abdominal activity. So where the abdomen actually unlocks and opens up, and to get it more diverse, let's look at several other ones so that we understand it's not accidental and it's really quite systematic what is happening there. And in fact, this view is even more informative, because here we can see the nice opening of the abdomen, and in this nice opening of the abdomen we can also see how once the overall fusion of the scar has reduced, we can really see what's happening. The abdomen itself unlocks, and then with this unlocking of the abdomen happens what? So you see you get this additional mobility of the legs. I hope that you're making the connection with what I was mentioning earlier, that the layers, are they fused or are they unlocked? As we unlock the layers, we gain the extra mobility of the legs pretty much for free. And then, if we start looking closer at this one, so what we are seeing, in fact, this challenging situation, that everything is really jammed very closely. So part of those muscle lines that we saw on this picture, see these lines over here, they get very much fused, because you see this kind of line that we saw here from the transversus abdominis and this line from the center, they pretty much been fused together by the scar. And what you're seeing in this video, you're seeing that the left side of the ribs get disproportionately pulled in, so it's a kind of it's a sharp cut and a sharp overlap. And in fact, if you start looking at it even closer, what you're going to see, like first point is like this abdomen now is a lot more open, right? So, and in fact, here we can see the end of the ribs, and that's the beginning of the pelvis. So between them there is a space, whilst what we saw before was the situation where the ribs were literally overlapping the pelvis. So the child's body was really collapsing on itself. But that's not all. What we also see is this. See here, as we zoom in and look at the whole situation, so we can really observe that even the belly button is not really deeply positioned. And as I'm kind of getting some basic testing here, so even the minimal moves, they drag both the belly button and the peg button itself. So that's a combination that we're seeing here. And if we look at the dynamics of the respiration, you can see that under my hand, you can really observe how the ribs on the left are moving outwards, and then underneath them, this is a really strong suction of the stomach inside. So, and again, of course, this type of challenge creates an additional troubles for the digestion itself, because that's a suction of the abdomen inside. So, and as we look through, you can see that in the before video, it's very difficult for me to catch any kind of abdominal response. So you see, I'm trying to look here, but it's so thin. The abdominal wall is so much under tension that it's really impossible to do any grip. And if we look at the new one, right, so you can really see what's happening. You start seeing how it's getting possible to see the skin lines and the articulations of the abdominal wall, and the emergence of these muscles, right, the descending part of the muscles which are coming from the top, because that's the external oblique, so that's a second layer after the first one, so which is really showing up, and respectively that is contributing positively towards the balancing of the rotations and developing the freedoms of the upper body. So, and here you can see that really the similar types of the grips which are coming from below, so they are coming up with a very different situation. And you can really observe that everything is really like the belly button and the scar, they were really kind of jammed together. And now we really observe how the entire abdominal space opens up. So now let's have a really close look, and you can see here that the before, the scar is really stuck between the layers. What we see now, that everything is a lot more movable. That's really the indication not only of the ungluing of that scar at the most superficial layer, as we were discussing it here, so like the cosmetic effect, right? But actually it's indicating this entire depth at which it was kind of rooted and fused with the deepest, because it goes all the way through the peritoneum in order to reach inside the stomach, right? So that all these layers, they really started to unglue. And that's what we can see very, very clearly upon the zoomed observation. And I believe that also the texture of the scar, it's very different. You can really see it very well. So the next important thing we see about the scar is that from being really very, very stuck again, which we observed like going directly at it, now if we look at the greater transition of the skin, what we are seeing, we can see that the two side layers, two side levels around the midline, or they have opened up, and now it's getting possible to kind of engulf the scar inside. And together with it, we also have the other process that when we change the grip a little bit, you can see that the scar itself is really showing as a line that is reacting, folding internally into the linea alba. So, and again, if we look at the previous observations, we can really see how much more stuck the entire scar is. So, that's obviously there is more than one view, and as we zoom in, we can really see these scar transformations very, very visibly. But also you see the really interesting part of it is that you can really observe how even the tension and the configuration of the belly button has changed. And now we looked at the scar across, now we'll look at it along. Again, what we are seeing here, you see the scar is stiff and it's dragging the layers with it. What we are seeing now, you can really see that as I'm applying just minimal loads to the two ends of the scar, you can really see how the whole thing just stretches and then sinks in. And you see, if before I was also, by trying to move the scar, it was really pulling the belly button, and with it, with the belly button obviously challenging all the internal organs. So here we can see really much improved freedoms, and then you can have a lot of extra kind of different details of what's happening to the scar, and that we were able to allocate from within, to the point that we have even this type of the response. You see here, once the scar has divided and accentuated in the layering, you can see that it's possible to do the horizontal fold. So this horizontal fold, that's a primary change of the map of the abdomen. So this is really the observation which shows how the progress of the scars is taking place, and that it's very important on the one hand to take a closer look and pay attention to them, because they're really bringing a lot of additional troubles. But of course, on the other hand, if you are in this situation, you're realizing, okay, so yes, that's a scar, and this scar is really deep and troublesome and affecting the respiration, digestion, and also the movement and the child's development. Like, what do we do? So that is really the key point. So whenever we are kind of highlighting any type of challenges associated with the previous procedure, in that sense surgical procedure, we have to ask ourselves, okay, but what are we thinking ahead and with, and what's their real kind of goal and outcome? Because again, if we are thinking in terms of scars being permanent, well, then we have a problem, right? So you see, then it's like, okay, it's just the side effect of the much more important surgery, and there's nothing you can do about it. But this is the video which is showing you that clearly there is the way to deal with it, that there is a way to improve the situation, and that's a combination of the micro vibration tools together with a special ABR fascia gel, which really helps to unglue the troubles related to the scarring and the fusion through the skin, mechanical fat, and so on, and that we are able to start restoring this fine microstructure. And it's also thanks to this fine microstructure that the mobility of the scar, flexibility of the scar appearing, the mobility of the layers is appearing. And then that's really the thing. So okay, so I'm filming this on the 28th of November, so it's the Black Friday, so we have the special promotion offer, but that's really not the key point, right? So the key point here is for you to see the importance of the thing and to really understand that, okay, for every child who had a tube feeding installed, it's not just the feeding that plays the important role in the future development, but everything that goes with it. That once, and especially if it happened like for a long time. But the main thing that I want to say in this video is that really but the main purpose of this video is to give you this solid conclusion. Scars matter, and scars need to be addressed, because scars affect a lot of the related components of the development. You need to help your child to unlock the entire abdominal wall. So what I concentrated in this video is to show you at least the basics of how it works, to give you the illustration that yes, the scarring creates the troubles for the respiration, digestion, and everything else related to the leg movements. So that the changes respiration is really, really essential. It's a driver of everything related to the development, and that we really need to get this big picture changed. And again, to close this video, I'm going to show you some dramatic illustrations here. You see how that skin conflict spreads and what is the much improved situation that we have now. So everything related to the scar sits under the ribs, and in the before video we can really see everything that related to the scar just affects both the ribs and the abdomen itself. So it's a big conflict. So change the conflict, improve your child's life in more aspects than one. So, and it will contribute both in the digestive way and in the overall development elsewhere. So that's a special focus which requires a special attention, special program, but it's not something large, right? So you see, this is the span of 2 years of what we see as the change 2023 versus 2025. But if we take it in absolute numbers, so that was about 10 minutes a day. So therefore it's about, like, if it's done 5 days a week, right? So you've got approximately 50 minutes per week, roughly, with all the holidays and so on. It's about 40 hours per year. So therefore, from here to here, it's about 80 hours of network. Now, it's entirely up to you to consider this, either it's a large number or it's a small number. But these 80 hours make a huge difference to the future and the present of this child. And I hope that that kind of brings you to this realization and understanding, and look for a solid, consistent program of what one needs to do Even again, if it's 10, 15 minutes a day, then it accumulates and it brings massive differences in everything from eating, breathing, and all the way to the posture, movement, and so on. Thank you for your attention, and looking forward to hearing your questions.